Hello everyone, it is my pleasure to attend this international conference in Pakistan. And this is Parisa Mohammadisefat, a PhD student in agriculture scientist from University of Urumia from Iran. I want to talk about monkeypox poses a serious public health challenge. We have prepared this precious information under the supervision of Dr. Zuri Zahra for anyone interested in. As you see here, there is a table of contents including some topics that I want to talk about them. In this slide, I want to talk about etiology. Human monkeypox is a zoonotic orthopox virus that clinically resembles smallpox, making it troublesome to diagnose it from smallpox and varicella. Monkeypox virus, a linear double-strand DNA virus that lives in the cytoplasm of infected cells, is one of the most virulent members of the orthopox virus genus, the family Paxviridae. Most human contamination happen in Central Africa, where screening is tested in remote areas with little scope, but may be conducted using evidence-based methods and educational material that educate general health workers on the crucial standard of these contaminations. There are two clades of monkeypox virus species, the West African clade and the Congo Basin clade. Here we want to talk about pathogenicity and clinical signs. The virus replicates itself at the site of inclusion and then spread to regional lymph nodes. Monkeypox virus manifests with such clinical features as headache, fever, sore throat, swollen lymph nodes, and characteristic rashes or lesions that progress to that eventually cross and form a fresh layer, but the scars remain the skin surface. The rash typically begins to show within 1 to 5 days of the fever, and it is noteworthy that the patients are contagious when the rash appears. Lesions commonly occur in the face, 95% of the cases, and the palms and soles, 75%. These symptoms generally appear after 5 to 13 days or a maximum of 21 days. The infection is self-limiting and is treated after 2 to 4 weeks. This disease, unlike smallpox, has mild symptoms and severe patients are observed in the children. In this slide, I want to talk about host immune response to monkeypox virus. The immune response of this virus is not sufficient. The monkeypox virus has made immune system response to infection the worst because it uses various mechanisms to evade it. First, natural killer cell or NK cell directly kill the infections that cause the monkeypox virus. IFN-gamma and some pro-inflammatory cytokines such as TNF-alpha indirectly cause inflammatory responses in the infected cells. One of the biological features of the pox virus is its involvement, as it can help the virus to better survive or to evade the host immune system. This outer layer or envelope is derived from um, infected cells or host cells. A variety of animal species have been identified as susceptible to the monkeypox virus. Most mammalian species have been infected with this virus, showing that the host range is broad, and some of the infected animals in the table have been reported to be infected with monkeypox virus. As you see, animals infected with the monkeypox virus, like natural host species with their location, uh, shows here in the table. Like African head hogs, Gambian poached rats from Africa, African dormice from USA, shuttle-tailed opossum from USA, and sun squirrel from there, and giant anteater from Rotterdam, and so on. In this slide, I want to speak about or talk about the mode of the transmission. After the global eradication of smallpox, monkeypox appears to be the most common orthopoxvirus infection in humans. In addition to the routes mentioned that require direct contact, there are also assumptions about routes that do not require direct contact, such as airborne transmission. As you see in these two parts, I want to talk about animal to human transmission. This usually occurs through direct contact with contaminated animal or their bodily fluid, blood and skin lesion, and even bites from an infected animal. The second part is about human to human transmission. It required close and long-term physical contact with patient lesion or virus contaminant objects or surroundings such as patient clothing or bedding. Risk factors. Several factors have been recognized to play a significant role in increasing the risk of infection, including prolonged physical contact with patient and family members, unsafe sex, male gender, breastfeeding in newborns, men who have sex with men, MSM, teenagers under 15 years, dealing with animals, living in rainforests. Epidemiology. Since 2016, human monkeypox has been confirmed in 10 African countries, including Congo, Libya, Central African Republic, Nigeria, and Sierra Leone. Each of the 6 US states had at least one incidence of monkeypox. Monkeypox virus was reported outside of Africa on May 26, 2022. In 15 European countries, 6 Asian countries, Australia, the United States, and Canada. A recent study indicates that the current outbreak originated from the West African clade. Since the start of the monkeypox outbreak and up to the 1st September 2022, 1804,063 confirmed cases of monkeypox virus have been reported from 29 UA countries. In Asia, the number of new infections is low compared to Europe and other continents. 249 cases of as of 30th, I guess about 86% of the cases are detected in the Western Asia. As you see, we have the column about epidemiology from countries. We have the prevalence analysis in which it is clear since mid-May 2022 more outbreaks have been observed in American and European countries. At the time, certain diagnostic methods have been confirmed and used. The specimen for laboratory include a skin lesion, crust, and fluid in the vesicle or pustule that may contain the virus, the patient's blood, and blah blah. And now I want to speak about sorry, we have several there are several common diagnostic methods, including molecular method, serology, culture, and immunofluorescence. Phenotypic methods. Molecular methods. The most accurate diagnostic method is polymerase chain reaction (PCR) or RT-PCR. Serology. Monkeypox can be diagnosed by detecting IgM and IgG in the serum after about 8 days from the appearance of the rash. Culture using cellular or cheek coriolytic membranes in isolation aligned with ACL on DNA assists the detection of virus. Immunofluorescence, the less effective way to detect monkeypox virus, since it can get misdiagnosed from other pox viruses. Phenotypic methods. It is necessary to pay attention to similarities between monkeypox virus rashes and other members of the pox virus pox family. Observe the specific manifestations of monkeypox, uh, such as lymphadenopathy. As you see, here we have a table of PCR methods and gene sequences and which type is more definite. In this method, RT-PCR is better than LC-PCR. While monkeypox virus is re-emerging as a treatment and raising international concern, most patients recover without a specific therapy, usually after 4 weeks. However, public information and education is crucial. However, the clinical signs of monkeypox virus are mild and known to be self-limiting. And here there is several drugs have been recognized to affect the healing process of disease, including pseudofever, tecovirimat, and VIGIV vaccine or immunoglobulin intravenous. Pseudofever is This antiviral drug can act as an inhibitor of DNA polymerase. The complete and definitive clinical results are still unclear. Tecovirimat, approved by FDA and EMA, also can be given orally. VIGIV vaccine, it can be used to treat monkeypox infection. Observed studies have proven that it can reduce the possible side effect of the cowpox vaccine. In this slide, we want to talk about control and prevention of monkeypox virus. Multiple measures that assist the infection from spreading include isolation of infected persons in separate rooms and avoiding any physical contact with them. Also, healthcare professionals should be equipped with standard gloves, masks, and gowns. Common approaches to safety, such as washing frequently, can definitely be effective too. There are some ways to control or prevent the spread of the disease. One study shows that vaccination is an effective way. Prescribed and used are commonly known as smallpox vaccine, monkeypox vaccine. The first one description is one of the most effective ways to protect communities is smallpox vaccination based on newly studies. Injection after 4 days of close contact can play an important role in disease prevention. There are still conflicts about how long the given immunity lasts, but pieces of evidence report that after smallpox eradication, vaccination has been discontinued. Thus, new generations are more susceptible to infection. After almost 3 decades, vaccinated populations against smallpox have a lower likelihood of infection. The second one is monkeypox vaccine. It can be administered for persons with a high risk of infection like healthcare worker or population with a large number of newly cases since 2019. GYNNEOS, 2 dose series vaccine approved by FDA is administered. Here we go. Eventually, we achieve conclusion. After the smallpox eradication, monkeypox virus has been known to be the most prevalent orthopox virus. When informating the expert and public is quiet in this event. The clinical exhibition of the disease is remotely indistinguishable from smallpox or chickenpox. Thus, we need laboratory tests for precise diagnosis. For precise diagnosis, avoiding close contact with infected person or infection-suspected animals is vital for prevention, and patients should be quarantined. Uh, Nevertheless, the risk of pandemic is low. Governments and global public health should not ignore the dangers. And thank you for your attention.